Dr. Aminu Magashi Garba. I'm the chairman of the governing board of this agency called the Kano State Ultra Modern Specialist Hospitals, established by the Kushlo early this year to manage the two ultra modern gigantic center established by this government, Muhammad Buhari Special Hospital and Sheikh Khalifa Isa Karabi Pediatric Hospitals.
The two hospitals, if I can get you right, you said is a private-public partnership. I mean, how do you move with that?
So it is a public-private partnership established by the Kushlo with the aim of ensuring quality state-of-the-art services that are not available in many parts of this country. We are providing the service. You have seen the operations, you have seen the services, you have seen the equipment and the facility. Most of the things you have seen here are not available anywhere in this country. So we believe that the partnership will bring sustainability in what we are doing. It's going to ensure quality, it's going to ensure sanitation, it's going to ensure the brain drain that we have been experiencing in this country. We're not going to have a brain gain by having this center in Kano. Many doctors all over the world are coming to work here to bring their own expertise into Kano State.
The two hospitals and the border was established was aimed at providing health facility to the populace at less prices.
Yes.
I mean, how do you go with this when you talk about public-private partnership?
Yeah. So there are so many innovation we are bringing to ensure the poor man also can access services. Of course, as a public-private partnership, of course there are prices. They may be slightly different from the normal public, but we are working with all the government agencies to ensure that services are subsidized. We have the National Health Insurance Scheme, we have the Kano State Contributory Health Management Scheme, we have the Kano State Health Trust Fund, we have a big, important business community in Kano. We are all mobilizing them to see how services could be subsidized, and I give you the assurance that by the time we will come back to this meeting after 3 months or 6 months, you will see a lot of improvement here.
And we as private managers, we're here and we hold this as trust between us. Most of us are people that are from Kano. Even if we are not working in Kano, like myself, I'm working in England, but I schooled in Kano. My secondary school and my primary school before going to University of Ibadan and then moving to England for the last 19 years. But alhamdulillah, we are channeling all this expertise we have abroad to come back home and try to deliver the same services we deliver abroad, but here in Nigeria without the need for you to travel. And why they are different is because we don't have any interference. There's no interference of government, the governor, the emir, nobody has sent any staff to be employed. I've not employed anybody from my family. In fact, I can tell you categorically, I've not interviewed any of the staff. We have over 200 staff. Everyone applied, they have an aptitude test, they are recruited on merit. And you work here, we pay your dues, and we have a lot of specialists. They can come from anywhere in Nigeria. As long as they are good, you've seen from yourself this morning, there's a professor coming from another hospital. We have another doctor coming from ABU's area. Just yesterday, a consultant went back to Saudi. He came from Jeddah. He's a consultant cardiothoracic surgeon. He's also a product of Kano State. So what we are hoping for is that we channel all the expertise we have to come here and deliver world-class services. And alhamdulillah, we can say it categorically, we are not under anybody's influence.
But when we talk about accessibility, how cheap is it for people to be able to access the facilities at these hospitals?
I can tell you we are accessible and is affordable. For example, the charges we charge per night is 5,000. If you want to have antenatal services, including 3 scans that you have during that labor, including postnatal care and medication, is 35,000. If you want to deliver through normal delivery, is 50,000. If you want to have an operation like CS, it's 150,000. And for normal consultation, you just pay 1,000. And our drugs and pharmacy, they are comparable, even cheaper than most of the other hospitals. Remember, we are not here to make profit, and the government is not here to make profit. People have asked me several times, if I want to make profits, I won't be here. As a consultant in brain and spine surgery, if I work in America or UK, I can earn over $1,000 per annum. In fact, not $1 million per annum. So I cannot, in Kano, the people cannot, most of them cannot afford to pay me. And it's not just me, but many of the other doctors. But what we want to do is to give back to the society what the society has given us. And we have system in place. The Kano State government has reassured us that it's not after profit. All it wants is that the facility to be run and maintained.
Go with the machine, and you can use it to transport baby from one hospital to another.
So that the treatment will continue?
Everything continues. Everything. It has oxygen cylinder, humidifier, everything is attached to it. So you don't separate the baby from the treatment. It is on when you are using transport incubator. And I'm happy to see we are the first that have this one in the hospital.
How many do you
Big
have?
applause for that, please.
Sorry, five transport incubators.
Five.